I don't know, when they tell you stuff that they're really excited about, like, oh, I had cheese yesterday, you know, like they hadn't had cheese in 5 years and they finally decided to, be brave enough to put cheese on their sandwich or something like that. And it just feels really great because you know how hard they're working and
Do you ever have so many questions and no one to ask, so they're just wasting away on Google searches you'll forget about in an hour or so?
We had that same problem, and that's why we created the RD2BE podcast, a resource for dietetic and nutrition students looking for answers that their peers don't have.
We are students Macy and Emily and registered dietitian Carl Barnes. We engage in conversations and learn from RDs.
Join us weekly as we gain insight into the unique journeys of registered dietitians all over the country.
Welcome back to another week of the RD2BE podcast. I'm your registered dietitian host, Carl Barnes. This is our weekly podcast where we sit down with a different registered dietitian to showcase the diversity of opportunity in the profession and really dismantle this notion of there being a traditional career path by showcasing all these awesome different routes that dietitians take, traditional and non-traditional, and what they've done and accomplished in their career. So super excited to be sitting down with Alex Raymond today. Really excited to learn more about you, and go ahead and take it away. Thanks for being here.
Yeah. Cool. Awesome. Well, thanks so much for having me. I'm excited to be here and happy to talk about, private practice and eating disorders. So yeah, I am the owner of a group practice in Maryland. We have, we have 3 different locations now. So we have 2 in Maryland and then 1 location in Northern Virginia. And we also see clients virtually in Maryland, Virginia, Pennsylvania, and Colorado. So yeah, I've been working in eating disorders pretty much since I started and graduated, my dietetic internship, which was in 2015. So about 7 years in June. So yeah, thanks for having me.
Great. Well, again, thank you so much for taking time out to speak with us today. So I know you went to UMD for undergrad, and you guys, at least in the curriculum that we have now, there isn't really much talk on eating disorders besides for a little bit of introduction and medical nutrition therapy. So how did you decide that this is your passion?
Mm-hmm. Yeah, no, that's a great question. And I was thinking back when I was looking at this question, like, I think we had 1 or 2 classes on eating disorders, and it was very basic. Like, here's anorexia, here's bulimia, here's binge eating disorder, which I think for kind of getting that introduction can be really helpful because of course it can spark interest with some, dietitians, or future dietitians, but it really scratches the surface of what eating disorder work is. When I was going into dietetics, I knew that I didn't want to do like weight loss. It wasn't anything that, I guess appealed to me. And I think my vision of being a dietitian was actually working one-on-one with clients in private practice and just overall helping them, build a healthy lifestyle. And that my definition of a healthy lifestyle has of course changed over the years with just doing more eating disorder work. But yeah, I actually started volunteering for a private practice that saw some eating disorder clients. And that's really what sparked my interest, where it's like, oh, wow, this is really cool. And this is really different. And in high school, I contemplated going to school for psychology to become a therapist, but then I decided against that. So I feel like being an eating disorder dietitian bridges nutrition, which I'm really passionate about, and kind of that therapy piece and that counseling piece. So it wound up being a really good fit for me.
Definitely. It sounds like it was a good fit.
Yeah.
So what's the most challenging part that you came across starting your own private practice?
Mm-hmm. Yeah. The first thing that comes to mind is just like getting the courage to start it, because there's a lot that goes into starting a private practice. And especially, if you have a job at a clinical position or a treatment center, or you're working for the community, it is a stable, steady job, right? Where jumping into private practice, it's not as stable or steady, and it kind of requires a whole set of skills that were not taught in school. So I think just having I actually worked for a private practice before, I started my own, and even that was getting the courage to just say, okay, it's time for me to start my own. I need to leave. I'm ready to branch out and do my own thing.
Definitely. And I guess talking about those skills, my next question is, what skills did you need to acquire to to sit down and achieve the private practice?
Yeah. I would say one of the skills, and this is less on the business side of things, but more on the client side of things, something that is really important is learning, counseling skills, because part of having a successful private practice is getting clients and then retaining clients. If you're seeing 20 clients, but like all of them are only coming for 1 or 2 sessions and then they're not coming back, then, that's not really going to be the most sustainable model, right, for a practice. So fine tuning those and working with a clinical supervisor. I know that Molly Kellogg also has a couple of really good trainings on motivational interviewing, which from what I remember from school, we like briefly learned that, at least at Maryland's program. So yeah, fine tuning those counseling skills. And then I also think like just building up the confidence and courage in yourself that like you can do this and you can start a private practice. I didn't have any business skills, so I did not go to business school. Like I kind of had to learn all of that on my own, and building a community as well where people are able to help you answer some of those questions can be really helpful. Haley Goodrich and, oh my gosh, I'm blanking on the other dietitian's name, but they have a program called Inspired to Seek. So it's it's an outline. Their program actually outlines kind of how to start your own private practice. And then, Emily, I see you nodding your head, so I don't know if you're part of their Facebook group, but they have a Facebook group as well where, you can ask questions about starting a business.
Definitely. So obviously you went the private practice realm instead of going to a community setting or in a hospital. So what added benefits do you think there are to a private practice compared to going into settings like that?
Yeah. For me, it's the biggest benefit is building relationships with clients. So, I can't really speak too much about a community setting because at least in my internship, I really only had 1 or 2 weeks working in those settings. But, in my clinical rotation, it felt like, the patients were in the hospital, and I worked at a really small community hospital during my internship. So they would be there for a couple of days. My role was literally to prescribe Ensure and just like send them on their way, and then they would leave. So, it was great that they were leaving the hospital and that they were feeling better, but I also felt like I couldn't really connect with them. And even the times when it was my role to counsel people, like they needed a diabetes education, or maybe it was about heart health or whatever, like I felt like they weren't really paying attention because they just, maybe they had an episode where their blood sugars were too high and they had to get sent to the ER, and then they were admitted to the hospital, or they just had surgery. So like totally fair that they weren't really paying attention. That wasn't to nutrition. That wasn't the primary thing on their mind, which like, obviously that makes sense. They're in the hospital. So, being in an outpatient or being in private practice helps to, I felt like I could really build those relationships. On the more practical side of things, definitely flexibility, because you can, like, I don't start my day until 10. I usually don't start seeing clients until 12 or 1, just because I prefer to get work done in the morning and then see clients in the afternoon. So definitely flexibility with work hours.
Of course. So how long did it take you to acquire the CED-RD
certification? Yeah. So to get that certification, it's a certified eating disorder registered dietitian. And then I'm also an approved supervisor, and that's through IDEP. Yeah. So that's what the little like -S is at the end of the credential. But yeah, so that it takes you at a minimum 2 years, and you have to acquire 2,500 direct client care hours. And all of those have to be supervised. So you need, I want to say it's at least, they might have changed this recently, but I want to say it's at least 21 hours of supervision throughout, the whole process. And then you also have to take an exam. You have to take something called the core courses, which is basically teaching you about eating disorders. And then what was the other thing that I had to do? Oh, you have to write a case study. So yeah, you need to do all that. Like they ask you to, you can't complete it for sooner than 2 years. So yeah.
And then what motivated you to get that credential?
Mm-hmm. Yeah. I mean, I was part of it was like, okay, I'm doing this already. Like I'm working with eating disorders and, I want something that I guess sets me apart, that really shows that, hey, I solely work in eating disorders. This is what I do. I have all these hours under my belt from, counseling and working with clients and for supervision. So similar to, a CNSC, I feel like it's something that just sets you apart from other dietitians who might not have the credential.
Great.
Yeah.
So I was wondering if we could talk a little bit about like the practice itself. So when I hear eating disorder and like dietitians, I think of, something inpatient where, patients are living there or clients are living there. So what is your setup?
Mm-hmm. Yeah, that's a good question. So we work, and when I say we, I guess I mean myself and then the other dietitians that work at the practice with us. We see clients usually on a weekly basis for an hour a week. So they're doing 1 week with us 1 hour with us and then a separate hour with their therapist. And we do a wide range of things. So some of our clients are stepping down from that treatment center and they're looking for, consistency, accountability, support on an outpatient level. Because when someone goes to treatment, once they step down, it's not like they're all better, it would be great if it was that way, but they do need that continued support, from a dietitian and from a therapist. So yeah, we'll do goal setting with them. Sometimes we'll do meal planning. A lot of times we're doing deeper body image work and exploring their relationship with food. So having conversations about, where they've gotten the idea of like how they're supposed to eat, or where they've gotten the idea that they need to lose a certain amount of weight or that their body needs to look a certain way. Conversations about diet culture and how that shapes our beliefs with food. Even conversations about friends or family members or doctors. Like I think there's a lot of negative food talk out there, as I'm sure, both of you see, that can be pretty harmful when you're in recovery. That's the stuff that I like doing more. I don't like coming up with meal ideas or snack ideas, which is funny because like you would think that that's what a dietitian does, because we talk about food all the time. But I would much rather have those deeper conversations about someone's relationship with food.
Definitely. So
Yeah.
do you see one eating disorder over another, or do you see all types, or how does that work?
Yeah, I'll see all types. So there's not really a cutoff, I guess, for a diagnosis. And then I'll even work with people who might not have an eating disorder diagnosis, quote unquote, but like they, have disordered eating or just looking to improve their relationship with food. I prefer to work with people under 25. So like any kids 6 and up, high school students, college students, and then young adults.
But so your practice encompasses all ages, but you just prefer that.
Mm-hmm. Yeah.
So do you need like a reference to be able to go to you guys, or since you said that you just see people who have disordered eating, not eating disorder, which is open?
Yeah. You don't need any type of reference or referral to come see us. So we'll see anyone.
Great.
Yeah.
So I also saw that you guys work on incorporating intuitive eating and HAES into your practice with your clients. So can you just talk a little bit about that?
Yeah. So we use health at every size, like the health at every size model and the intuitive eating model when we're counseling clients. And intuitive eating is a health at every size like approach to nutrition. And for those of you who might not know, who are listening, intuitive eating is a book that was written by Evelyn Tribole and Elise Reich. So if you have any interest about learning more about intuitive eating, I would encourage you to check that out. But essentially what we do is when we're working with clients, we don't use any numbers, any calories. Sometimes there's weight goals, but that's usually to, if a client needs to weight restore because their body's, at too low of a weight where it, feels comfortable. But yeah, so we focus on that. And again, like really working with our clients in learning how to interpret their hunger and fullness cues, learning how to interpret their cravings and when they might want to rest instead of move, that kind of thing. So yeah, it's a little bit different than like setting up just here's the amount of calories that you need, here's your meal plan. We really want to help our clients kind of make those decisions on their own.
Definitely. So obviously Haze, I feel like it's pretty controversial, just in the dietetics profession in general. So what do you think are some important things that people should know about it from your perspective?
Yeah. Yeah, there's so much that goes into this question. And it's almost like, I'm like, oh, I could give a whole 2-day long presentation about health at every size and like what that means. So I would probably say that the number one, well, right now, how I'm feeling, like the number one thing for people to know about health at every size is it does incorporate health, right? I think a lot of people have this assumption that, if you're promoting health at every size, you don't care about health, like you don't care, you're just promoting eating quote unquote junk food every day, or like you're, promoting quote unquote obesity, but in reality, what it means is we're supporting our clients to get to like work towards their definition of health as opposed to society's definition of health. So I feel like the medical field, and the nutrition field too, we have all of these markers as what we define as health, but the reality is not everyone is going to be able to get to that place. So what does that mean for each individual client? Not weight loss isn't a part of that. It's changing, behaviors and feeling better about their food choices, feeling better about their body, and also taking into account, again, not everyone is going to be able to get to a place of what like the medical field defines as health, especially with lack of insurance or lack of access to food. And, I think as the medical field also has like a very narrow view as what weight is defined as quote unquote healthy too. So that's, yeah.
Definitely. And I feel like that's a great approach to have, because, I kind of, before this, thinking about Haze and like, okay, it's very black and white, but there is such a gray area in the middle that it isn't just one way or another. So I think the explanation was very clear and easier to understand.
Yeah, definitely. Yeah. And even with like just the years and years and like we've been trying to fight this quote war on obesity since like, I don't know, the 70s or the 80s. So it's been almost 50 years and like it's not budging. Like, no, we're not, like, no one's losing weight. We're not getting, any thinner. So even keeping in mind that like just this weight, like the years of research that we have about weight loss, like it's not showing that weight loss is sustainable, because at this point we probably would have figured it out, right? With all of the research, all the technology, all the money that's going into the weight loss industry. But, so maybe it's just time to try something a little bit different that doesn't involve, shifting body type.
And I feel like your practice of understanding, appreciating, and respecting, food and like just having a positive relationship with it could be a better approach than having, that weight loss or like you have to lose weight to fit society's version of healthy.
Yeah.
Great. So you also mentioned that insurance can definitely be a barrier. So in your practice in particular, what barriers do you have with insurance for those who have eating disorders or disorder?
Yeah. I think insurance companies don't I just don't think they get it. Especially, I mean, my brain is actually going towards more when we refer clients to, a higher level of care. So if they have to go to a residential facility or a day program, some insurance companies will cut them off after 2 weeks at a residential program, which is not enough time for someone, who's in a place where they really need 24/7 support to get better and to heal their relationship with food. So I think they just don't understand what goes into eating disorder recovery and what that means. And I feel across the board, I don't think insurance understands what doctors, what dietitians, what, dentists, I don't know, do in order to support their clients. So that can be, pretty frustrating.
Yeah. So how do you guys, I don't want to say work around it, but try to work with it to make it beneficial for both parties?
Yeah. So some of that, so some of that might be talking to an individual client's insurance company. So they'll ask us for notes, or they'll ask us for a letter, or we might have to do something. I want to say it's called a peer-to-peer, or like a peer review or something like that, where you actually talk to a clinician at the insurance company to explain why you're doing what you're doing. So we'll do everything we can to help clients get coverage, but ultimately at the end of the day, it's up to the insurance company to decide whether or not they're going to reimburse for, our visits and stuff, which again is really frustrating, but.
Definitely. And I don't know. So I know that's for certain disorders, we'll use disorders,
Yeah.
that they can get, insurance and help from the government. Do people with eating disorders also get that?
Yeah, that's a great, so it's very complicated right now. There's an organization called the Eating Disorder Coalition. So if anyone listening has any interest in advocating for eating disorders, I would recommend checking them out, because they're currently advocating for eating disorder coverage with Medicare. Because Medicare covers for diabetes and kidney disease. So, and from what I understand, I went to an advocacy day a couple of years ago before COVID. And from what I understand, Medicare like sets the standard for other insurance companies. So they're, hoping that they'll be able to get some coverage through Medicare. I don't think that's passed yet, to be honest with you. I'm not really sure at what point in the process they are, but the long way to answer your question is they're working on it. So right now there's not really a ton of coverage for some of the federal and state funded insurances, but like they're getting there. So yeah.
Yeah, I feel like that would maybe fit in the criteria for, coverage.
Yeah. I know some treatment centers accept Medicaid. So that's definitely something to, look into, but it's hard because they don't give a ton of coverage.
Exactly. So I guess my last question is going to be, what is the most rewarding part of your job as a dietitian?
Yeah. Yeah, I mean, I guess there's two answers to this. I think, on the client side of things, like, I don't know. I mean, seeing clients make progress with their relationship with food and, just feel better about food. And I don't know, when they tell you stuff that they're really excited about, like, oh, I had cheese yesterday, like they hadn't had cheese in 5 years and they finally decided to, be brave enough to put cheese on their sandwich or something like that. And it just feels really great because you know how hard they're working and that they're, getting so much better. And then I think more on the business side of things, it's always nice to hear what like the dietitians that work with us are doing, and seeing them just kind of learn how to better support their clients, or it feels good when like your business is growing and like people who work with you are also, doing the work that you had envisioned, if that makes sense. So,
Definitely. I'm sure it's great to see not only you have one practice, but now 3, and telehealth in, I think you said 4 states. So that's very broad, and I hope it keeps that up for you guys.
Yeah, absolutely.
Great. Well, thank you so much for taking time out to speak with us. I appreciate it.
Yeah, you too.